Hi, this is Tom Buck, and I'm talking about my paper, which is the National Rural Health Resource Center, an Emerging Mobile Technologies Initiative. So that's what I'm going to be talking about in this video, and I hope it's okay. I'm not having any webcam video of myself. Instead, I thought I would record my PowerPoint and share that with you. Anyway, without any further delay, let's do it. Okay, this is an overview of what I'm going to be talking about in this video. First, I'll be giving some background information to put the topic in context. I'll be talking about the particular healthcare organization, current and emerging mHealth technologies, which includes helpful apps, physicians prescribing mHealth apps, and how they build relationships through mHealth apps. Also, current trends in mHealth app usage. I'll cover briefly security and privacy concerns, and then I'll discuss the challenge itself in a little more detail and the Rural Healthcare Initiative. Okay, I'm going to start with an introduction about the topic, which is again my Mobile Technologies Initiative. So, in the world of rural healthcare, the number of primary care rural physicians is really shrinking, and accessibility is becoming more and more of a dominant challenge. The National Rural Health Resource Center in Duluth provides technical assistance, information, tools, and resources for the improvement of rural healthcare, and it's considering adopting an initiative to integrate the newer technologies in mobile healthcare. To give you some mHealth apps allow providers to interact with their patients on multiple levels, making their healthcare services more appealing, cost-effective, and accessible. Okay, in this section I'm going to be covering some background information to put things in context. First, I'm going to talk about the healthcare organization, then current and emerging mHealth technologies. These include helpful apps and prescribing mHealth apps. Then we'll talk about how they build relationships between the provider and the consumer or patient, and we'll also look at current trends in mHealth app usage. That includes both the physician mHealth app usage and the patient mHealth app usage. Okay, the organization is called the National Rural Health Resource Center, and that's in Duluth, Minnesota. The basic economic healthcare factors that they deal with are cost, quality, and access. The center operates as a rural healthcare information resource, and it provides education and technical assistance to both the providers as well as the patients. The center's three most relevant programs in relation to this initiative are the Performance Improvement Program, the Health Information Technology Consulting Program, and the Community Health Assessment Service. Okay, here we have two examples of helpful apps. On the left we have one called Migraine Buddy, and on the right we have one called DDS-GP app. And to tell you a little bit about the Migraine Buddy, it's a tracking and reporting app for migraine sufferers. It was released on the market in July 2014. The app not only tracks symptoms, severity, and frequency of migraines and supplies self-diagnosis information, but it also gathers data on the patient's sleep and movement patterns by smartphone sensor to create reports that define possible causes of the migraines. This mHealth app allows the user to communicate with their doctor and gives access to the information 24/7 in real time to their physician, making it as much of a collaborative tool as a tracking app. The app is available by invitation and can only be activated through the patient's physician or healthcare provider. Now over here we have a kind of a cool app, and this is called the DDS-GP, and it's an example of a helpful app but for professionals, specifically dentists and dental hygienists. This app has graphic illustrations of different things like periodontal disease, decay, cracks, and other conditions. and helps the patient take control of their dental health. Now, it's interactive, and the dentist will include images from the patient's visits to help them get a better understanding of where they're at. This is what we call a supporting mHealth app, and it holds over 200 interactive videos and diagrams. Again, the doctor can customize these images with the patient's x-rays and so on to create 3D models. They can also draw directly on the screen with their finger, save the drawings, add images to a photo library, or to create individual treatment plans for their patients. Another related growing sector in mHealth apps are apps that doctors and care providers can use to monitor and manage their patients' health by prescribing medical devices that work with mHealth apps, by either pairing the apps with wearable devices that transmit data, or use the patient's mobile device itself as a medical device, kind of like the migraine app, or tracking like the dental app. But these are unique in that they're prescribed. This is an example here that's done through the programs with Essentia Health at the Hibbing Clinic and St. Luke's Hospital in Duluth. Because of this, rural Minnesotans no longer have to make an office visit to the physician just to check blood pressure. Instead, patients can connect directly from their home to the provider's monitoring system to give both the EKG and blood pressure reading using mHealth apps in combination with devices like this. This is called the WeThings Blood Pressure Monitor, and it's available at Target and Walgreens and Walmart. But again, it's a device that would be prescribed by the physician or the provider, so that they can do regular checks without actually having to go to the hospital. Another aspect of mHealth apps is that of recruitment and retention. And a good example of this is the Walgreens app. It's a free health app, and it's named Walgreens. This app uses the camera on the smartphone to scan the barcode on prescriptions so that the order can be refilled online. In addition to that, and this is more the retention or building relationships aspect, Walgreens has added that in addition to filling your prescriptions, it'll help you locate stores and give you store hours. It'll set up prescription reminders, and it also allows customers to order prints of the photos from their phone. It'll send out such things as first to know notifications about new arrivals or sales, and I guess you can set the parameters on those. In general, those are health related, but I imagine that you could set up reminders or notifications about any particular category of products. All the while it engages and continually builds that loyalty of its health and prescription customers. Okay, now for some stats about current trends in mHealth app usage. First I'm going to talk about physician mHealth app usage, and then we'll talk about patient. Okay, as far as physician mHealth app usage, 3 out of 4 physicians are currently using mobile apps at work to save time, lower costs, and improve their quality. 47% of physicians have begun leveraging digital tools with patients, showing patients images or videos on their devices and recommending or prescribing patients' use of mHealth monitoring apps, and that's just in the past year. Okay, now for some stats about patients in mHealth apps. According to a number of recent studies, the most significant change in patient behavior in the last 5 years has been an increase in self-diagnosis. And according to a study done by R. Watson in 2014, he found that 86% of patients, this is nationwide, conduct a health-related search before scheduling a doctor's appointment. 67% of seniors say that They want 24/7 access to their health information. 70% say that they want to be able to request prescription refills electronically, and 67% want to make online appointments. And 58% want to email their healthcare providers for updates and consultation. And now I'd just briefly like to touch on security and privacy concerns. At the same time, as more and more patients get active through mHealth technology, security has become a dominant concern, especially among professionals and caregivers. According to a 2014 EHR intelligence survey of healthcare IT professionals, the potential of a breach of patient data through mHealth technologies is their greatest concern, and the use of personal mobile devices in a healthcare provider setting was their second biggest fear. Interestingly, though, the majority of the IT respondents, 68%, said their concern was over user misuse and error causing a data breach instead of a system failure. Okay, now I'd like to give a brief summary of the challenge that's caused by the growing deficit of primary care physicians in rural Minnesota, and then briefly discuss the benefits and recommendations of my mHealth app initiative. So, according to a recent report from the Minnesota Office of Rural Health and Primary Care, the fastest growing problem that will challenge Minnesota's rural health care is the increasing low number of primary care physicians. And in another recent report, using statistics from May 2014, the Minnesota Board of Medical Practices stated that fewer medical students are choosing to become rural general practitioners. Here's a graph that better illustrates this emerging shortage. This is from physicians' census data from May 2014. As you can see, the patient-physician ratio in the rural areas is 2,043 to 1 compared to, say, a metropolitan area, which would Minneapolis, St. Paul, which is 249 to 1. Or even in Duluth, I think it's in between these two, but still, it's nothing compared to what it is in the rural Minnesota. And now for a quick overview of my mHealth initiative. The initiative that I'm proposing for the National Rural Health Resource Center in Duluth is to help healthcare providers in dealing with this increasing deficit of primary care physicians in rural Minnesota by gaining the most benefits from mHealth apps. The center has an expertise in providing technical assistance, information, tools, and resources to all stakeholders, primarily patients, physicians, healthcare providers, and technology providers. This will easily allow them to help stakeholders team up, set standards, share experiences and best practices from the pilot projects already underway, such as those at the Essentia Health Hibbing Clinic and St. Luke's Hospital in Duluth. In researching this initiative, some of the key factors and takeaways that I found to make it work are that the population behavior change needs to be focused towards adoption of self-diagnostics and remote health monitoring through mHealth applications in rural areas. That the IT professionals and physicians need to address the lack of trust in the mHealth privacy and security systems. And a framework or infrastructure needs to be designed to manage and evaluate such programs in order to improve their efficiency and effectiveness, as well as sustainability. So, in summary, by working with the listed stakeholders, the National Rural Health Resource Center in Duluth can coordinate and supply technical support, training, and access to the necessary tools and resources in both the current and emerging technologies in mHealth, thus helping healthcare providers in dealing with this increasing deficit to the primary care physicians. If you have any questions, they're more than welcome. I look forward to your comments in the discussion. Thank you.